Here we will see why propranolol or non-cardioselective beta blockers are avoided in vasospastic or prinzmetal angina. Angina is a condition where there is imbalance between oxygen demand and oxygen supply. The demand is much more than the supply. In normal condition, what happens is there is presence of beta 2 receptor on the coronary artery. Stimulation of beta 2 receptor causes vasodilation by two mechanisms. It can be either through activation of GS type of receptor causing stimulation of adenylyl cyclase, causing more conversion of ATP to CAMP, and this causes intracellular surge of CAMP, which further cause the production of protein kinase A. Now, protein kinase A phosphorylates and inactivates myosin light chain kinase, which is required for the smooth muscle contraction. But when it inactivates, the myosin light chain kinase is not able to cause the contraction and thus causes relaxation. Otherwise, it causes the release of nitric oxide, which is itself is a vasodilatory in nature. So there is dilation of coronary artery, there is good blood flow, and there is no spasm. But what happens when we give propranolol or non-cardioselective beta blockers? As they are beta blocker, they block the beta 2 receptors. Since they are not cardioselective, it will block both beta 2 and beta 1 receptor. Since they block beta 2 receptor also, which are present in the coronary artery, there is no vasodilation, blockade of the pathway which I said, that is GS receptor pathway, and there is no release or lesser release of nitric oxide, and thus there is lesser vasodilation. Also, there is unopposed alpha 1 action. Beta receptors are blocked, but alpha receptors are still open. So those are acted upon, because of which there is vasoconstriction and there is coronary artery spasm, causing reduced blood flow, leading to ischemia and angina. So prinzmetal angina itself is because of the spasm of coronary artery. Further, if we give propranolol, it will further cause a spasm, and it's a dangerous situation. So what can be done? We can give nitroglycerin, that is nitrates. This is given in to cause acute relief. Then further calcium channel blocker like diltiazem, verapamil, amlodipine can be given, which causes vasodilation and relieves spasm, causing improved blood flow.